97% of people with systemic sclerosis have Raynaud's. And one of the things that many people actually have a real problem with are digital ulcers. We're joined today by Tani Ngcozana, who is a senior research nurse at the Royal Free Hospital and a PhD fellow at King's College London. Tani pioneered the first nurse-led digital ulcer clinic at the Royal Free in 2012, and she's very kindly agreed to share the approach that she takes to help people best manage their digital ulcers, as well as I think sharing a bit of your vision for the future, if I'm right.
Yes.
Whilst we then find the slides.
Okay, thank you for the opportunity. So I'm going to start by showing you just a small clip of how some patients describe digital ulcers. It was part of my my PhD study. I'll talk about the film later on, but just a clip. So this is how some patients describe digital ulcers.
Excruciating.
They are horrendous to try and get rid of.
Simple, painful.
It's so time consuming.
Horrible.
Horrendous. They're like evil.
Very.
Painful.
An ordeal. Excruciating pain.
So, very, very painful.
One word, hell.
Hell.
So what are digital ulcers? That's a normal hand on the right side. And for patients with digital ulcers, there are wounds or sores that develop on the fingers or toes of patients that are diagnosed with systemic sclerosis, which I'm going to be referring to scleroderma in the whole topic. So some of the causes and contributions of digital ulcers developing is Raynaud's. It can be contractures, and sometimes trauma. If you knock your finger on something or a door or something, it can end up developing a digital ulcer. And scleroderma as well, those with really tight skin on their hands and very dry skin can also result in digital ulcers. And it's skin deep. It's coming from damaged blood vessels in the body, and then they are manifested outside as ulcers. Sometimes calcinosis as well can end up causing digital ulcers at the end, where the skin breaks up and become an ulcer. Ill-fitting shoes can also result in digital ulcers because of the circulation problems that scleroderma patients have. So today I'm just going to share with you about managing digital ulcers in scleroderma and secondary Raynaud's. Digital ulcers affect up to 70% of people diagnosed with scleroderma. Therefore, it's a quite common challenge for the affected people. Digital ulcers easily develop complications such as soft tissue infection. Sometimes it can go to the bone, which is called osteomyelitis, and sometimes critical ischemia. I'm going to come back to critical ischemia later on. Sometimes some patients can end up with gangrene, and in some cases, amputations, which can be auto amputation, where the finger will amputate itself when the ulcer is dead and nothing is happening. And sometimes there can be surgical amputation where people have to go for surgery to be amputated, which is the last resort, and we are not very keen on that. The number of ulcers does not matter. Even one ulcer can cause hell for that patient who is affected. It also has a clinical burden where the quality of life of that individual affected is limited or reduced, and economical burden as well, where people are not going to able to go to work, or if they have to go to the hospital, maybe they travel a long distance, so they are spending money to travel for the treatment of the ulcers. And digital ulcers can affect mental health as well, because when you are in so much pain and you can't do anything, that affects your mental health, and it can make you feel down and you don't want to do anything. So digital ulcers are terrible, and that's what I was trying to show with that video. I've got a story for you, which I'm going to ask you to participate in later on. So just listen and pick up some points. So Beautiful is a 63-year-old lady diagnosed with scleroderma in the last 3 years. She is retired from working as a hairdresser. She is married and has 2 grown-up kids, and she smokes a packet of cigarettes since she was in her 20s. In her mid-50s, her hands started color changes, especially in winter and when there is a change of temperature. Beautiful enjoys outdoor life, and she usually goes hiking with her husband. When she goes hiking, she just puts on fingerless gloves, because that's what she's always done, and she finds that comfortable. She finds that her hands are very, very dry, but she thinks that dryness is just because of the history of her work that she used to do. So she just uses any kind of cream that she can find. Recently, they've just come back from hiking in the Lake District, and she noticed that she is having more Raynaud's attacks, and she has fingers, her fingers are tingling, and pins and needles, but she hasn't taken notice of this that much. So now I need you to take out your phones, if you've got any phones. We can try this if it's going to work. So she hasn't been taking care of her hands that much until this happens. She noticed these small sores on her thumbs. So my question to you is, what should Beautiful have done? If we see, if you scan on the QR code and just put in what you think Beautiful should have done. Is it working? Oh, you don't have it. Oh, you don't have access to internet. Oh. Internet, I think something guessed if you go to Wi-Fi. Oh, see, the doctor. That's really good. Which doctor?
Which doctor?
Any doctor?
No, the witch doctor.
The witch doctor? Maybe the rheumatologist? If she's under, she would be under a rheumatologist if she was diagnosed in the last 3 years. Stop smoking. Yes. Why? Circulation. That's really good. One warm gloves with silver. That's excellent. Use emollient with high urea. Why? Sorry? It gets into the skin. Yes. Okay, consult a specialist in rheumatologist with experience in ulcers. Yes, that's good. Okay. Insist on rheumatoid factor blood test. Why? She has a diagnosis of scleroderma already, and we have already said Yeah, she would have had a diagnosis of Raynaud's, but she, yes?
Because I think something about education.
Yes, education. Yes, that's very, very good. Thank you so much for your input. So I've got another one, but I'm going to skip it. What would you do differently? We've already talked about stop smoking, maybe go to see a rheumatologist, education, and taking care more of yourself. Okay, so signs of digital ulcer developing. In the study that I did, some patients could tell when digital ulcers could occur. So they reported some felt like a few weeks before, it can be even a month, they start feeling tingling and sometimes itching and tenderness or warmth, and sometimes color change on the area that's going to develop the ulcer, and pain as well, and increased Raynaud's attacks. And some patients said they don't feel any signs at all, it just appears. But what I'm trying to say here is you need to kind of know yourself, be aware on things that are happening in your hands and in your toes. So, hand heroes of self-caring. Now I'm going to talk about practical self-caring things that we can all do. So we have like 10 fingers. So I'm going to start with one. Keep your hands and nails clean and dry. Keep warm. Use and put on warm, maintaining clothes or gadget. And somebody mentioned it earlier on. Keep hands and feet moisturized and supple. And I can't reiterate the importance of moisturizing your hands and feet. These are our jewelry. We need to take care of them because we do everything with them. Ring finger, avoid tight-fitting jewelry and tight-fitting shoes as well. Stop smoking and avoid trauma. Sometimes trauma is difficult because you are just living your normal life, but it's just being aware of your hands, really. So right hand, know yourself. In a study that I recently conducted, as I said already, patients knew when a digital ulcer was about to develop. Make sure Raynaud's medications are maximized and take painkillers. I'm going to come back to the painkiller. If a digital ulcer is open, put appropriate wound dressings, and I'm going to come back to this. Be alert of any signs of infections. I'm going to come back to this. And protect your hands and eat healthily. Eating healthily is very important because for a wound to heal, it needs your body as well to be well nourished. No one treatment works in digital ulcers. It has to be a combination of different treatments and perseverance because there is no magic wonder. You can't have a digital ulcer today and tomorrow it's gone just because you've taken a special pill. There isn't anything like that. It's mostly about combining treatments and therapies and then perseverance. Mostly drugs that are prescribed for Raynaud's phenomenon help in digital ulcer management. There are vasodilators such as this, nifedipine, losartan, sildenafil, and then bosentan is usually prescribed. It's usually prescribed to combat the reoccurrence or reduce the reoccurrence of digital ulcers. The RAPIDS-2 study that was done quite a while ago in the 2000s found that bosentan reduces the occurrence of digital ulcers. But we now know that for some patients that take bosentan, actually their digital ulcers, they go away. And if they come back, they are not that deep. GT and patches also, these are medication that usually is prescribed for those that suffer from angina, hypertension, and sometimes heart failure. So they are prescribed cautionary in scleroderma, because if somebody has got low blood pressure already, they are opening up the blood vessels, so we wouldn't recommend that. So they are only prescribed by a specialist who knows what they are doing. And they are usually like put on the base of the hand so that the blood vessels are opened. So it's not prescribed for everyone. Antibiotics are prescribed when there is infection in the digital ulcers, and iloprost or prostacyclin are an infusion that are given in the hospital to open up the blood vessels as well. And painkillers are very, very important when somebody has got active digital ulcers, because it can drive you mad in terms of the pain that you go through. But caution has to be taken on the painkillers because they have side effects as well. So it's a matter of balancing the side effects as well as the positive effects of the painkillers. And they are usually prescribed. So I've put on lots of dressings here just to show you that there are lots and no one size fits all. There are dressings that are particular for a certain reason. The principle in wound management and in digital ulcers in terms of wounds, it's the same. There has to be a balance of a bit of humid and a bit of dryness. The ulcer should not be too dry and it should not be too wet. So some of the dressings can do that here. And if the dressing is infected as well, there are dressings that can be used for infected digital ulcers. For those that don't have the opportunity of visiting like a digital ulcer clinic, I would advise and recommend maybe to see your GP practice nurse for advice on the type of dressings that you can use, because mostly nurses, we have a small idea about wound dressings than if somebody goes to a pharmacist. Most probably the advice that you receive might not be helpful, but if it is a nurse, it can be better. Some other treatments are natural therapies, but there isn't any, we don't have any strong evidence in terms of research. In natural therapies, this is like word of mouth, but some people find it helpful. Botox is another treatment that can be given, but it's given in certain specialist hospitals, and it's very painful. But some patients, they say it is helpful. Wound debridement is a really good treatment in managing open digital ulcers, but it can only be done by specialists. And in this country, we only have a few that are able to do debridement. Please don't debride yourself, because you will cause infection and you will delay healing of that ulcer. So no wound debridement, self-debridement, I'd say. Amputation, I've just put it here. I spoke about it earlier on. In some cases, some patients have to be amputated, but it's the last resort. Paraffin waxing is very, very good, and it's underestimated, but it helps to open up your blood vessels, and also it makes your skin to be soft and supple. And this is something that one can do at home. At the beginning, it's a lot of faffing around and messing about, but as you keep on doing it, it's very good. If you've got an open ulcer, though, you can't directly wax. You need to put either like a cling film or some gloves and then you do the waxing, but it is helpful. And some patients report massaging, hand massaging, to be also helpful. Infection, it is very important to know about infection. If there is redness, here that picture is so prominent that you can actually see the redness, and sometimes it's difficult to see like in darker skin. But as healthcare professionals, we are able to see warmth or fever. Usually it's the warmth. If we touch, we can feel that there is warmth. And swelling is another sign of infection. And sometimes there is pus on that one. There is really clear pus, you can see it. And pain, throbbing pain, can be a sign of infection. It doesn't need to be for somebody to have all of them. It can be some of them, but you need to seek help as quickly as possible because digital ulcers can tend to complications quite quickly, and you don't want to be in a lot of pain anyway. Infection, what to do is take pictures so that mostly when we speak to our GPs now, it's mostly remote. So if you say, I've got an infected ulcer, they will say, send me a picture. If you've taken a picture already, you've saved your time. Seek help from GP, and if it is out of hours, 111. And for those that have got like specialist scleroderma or connective tissue disease departments, you can try and seek help there. If digital ulcer is wet, sometimes the GP or the hospital can ask for a swab so that they know what type of bug is growing in that infected ulcer, so that the antibiotics prescribed are directly to do with the bug that has been found. If ongoing digital ulcer, sometimes they can take an X-ray to see that it has not gone to the bone, and you'll be given either oral antibiotics or, if you are in the hospital, intravenous antibiotics. Apply appropriate wound dressings for infected wounds. And then I come back to ischemia, where there is lack of blood to the extremities. So we know with Raynaud's, the hands turn white, and then maybe they turn blue or purple, and then they turn normal again. But with ischemia, the hands remained darker colored, and it's an emergency situation. You don't want to spend a whole week like that, because it can damage blood vessels so much that it can end up causing like gangrene. So you need to act. If you see that your hands haven't turned back to the normal color that they do when you're having Raynaud's attack, then you need to seek emergency help. So applying wound dressings, I'm going to just rush on this. So it needs to be done in a clean area. You wash your hands, take your picture, wash your hands again, and apply irrigation solution or even tap water to clean the wound. Once it's cleaned, please do not touch your wound, because if you touch it, you introduce infection again. Then you apply the appropriate dressing, and then you apply a cover on top of the under dressing, and you can do all these styles with practice. And I am doing a project with SRUK where we'll talk more about this. Dressings can be changed every 2 to 7 days according to the advice that you would have been given by the healthcare professionals who would have advised you on dressings. If in doubt, ask a healthcare professional for help. I just wanted to put this slide, so please avoid picking on your ulcers. I know it's very tempting. Some people can't help it, but there is a major risk of introducing infection and actually delaying the ulcer from healing. So instead, why don't you just use wound dressings consistently, take your prescribed medication, and also seek help if things are not working. And using topical or cream antibiotics, we are not very fond of that because usually it introduces infection. It's about how you apply it. And mostly patients have difficulty in how they apply. So that introduces more infection, and sometimes it can worsen the distal ulcer. So we recommend oral antibiotic because remember, it's just not on the skin, it's skin deep. Applying paste like wound dressings such as Manuka honey, we don't encourage people to apply the Manuka honey directly on the ulcer. We recommend that you apply on a gauze, and then from that gauze you put it on your ulcer, because if you put it directly, that can introduce infection as well. Touching the ulcer, once it's cleaned, it's a no because of infection, yeah? So in summary, distal ulcers are common in scleroderma, and they cause a lot of burden for the affected people. There are treatments available to manage distal ulcers, and as I've said, it's a combination of quite a number of things, and there is no magic wonder. So seek help if you are in doubt. So from my study, I am working with SRUK. Some of the projects that are coming up is part of the video that I show. It's a short film that show people, other patients' experiences of distal ulcers, and we are in the process of developing a distal ulcer care booklet and a distal ulcer care plan as well to help you to self-care for your distal ulcers at home, because we know we only have 2 distal ulcer clinics in the country, so you don't have the opportunity to maybe come to those specialist hospitals. So with this, we hope that it will help you to self-care at home. In the future, there will be like a GP protocol, because sometimes when you go to your GP, they do not know what to do with you if you've got ulcers. So hopefully that will help, and a distal ulcer dressing pack, and some more projects to help with distal ulcers. So you can come up, I don't know, I'm going to,
Time for questions.
Okay.
For the film, but we can show it later.
okay.
Tani, thank you so much. I think that was incredibly comprehensive. And as Tani's saying, I think there is going to be quite a lot more really helpful information coming your way in the next 6 months. And what we wanted to do is work with Tani, who's done great work to provide really practical resources. And because as we've identified, there is a lack of clinics to help with this. So what we're wanting to do is empower patients through these resources. So I would like us to give a really big round of applause.